everyone, welcome to my talk today, Service Evaluation in Healthcare, and I'm going to provide a simple overview linked to 2 service evaluations that I've been involved with in the past. This video should be helpful for any students looking at quality improvement or change management in modules, or you might be looking at your dissertation and weighing up whether to do a service evaluation or quality improvement project. And last week I did a video on quality improvement, so do check out my other videos on my YouTube channel. I have a playlist on quality improvement. Give me a thumbs up if you enjoyed the talk today, and I hope you find it helpful. So before we look at service evaluation, it's important to know the difference between audit and service evaluation, and sometimes these terms can become confused. Both aim to improve quality of patient care. Audit aims to measure the quality of patient care against an agreed standard or a national benchmark. So an example would be a hand hygiene audit that's used widely across our healthcare services in the UK. And handy hygiene audits relate to a national protocol for measuring how good healthcare workers are at cleaning their hands. So during an audit, the staff are observed in practice. The people doing the audit will use an audit tool. There'll be tick boxes, and you will tick whether a staff member is going through the 5 moments of hand hygiene or not. Once an audit's complete, the data is collected and it's expressed as a percentage. So with a handy hygiene audit, the percentage of times hands were cleaned by staff using good hand hygiene would be a finding. And post-audit, managers receive feedback, and that informs future actions to either sustain good practice, or if there's poor results, then we learn and actions will take place, such as staff education, or for handy hygiene they might put more educational posters near sinks prompting staff to use good hand hygiene. Audit also uses a cyclical approach, so you don't just go in, you have to re-audit and monitor whether quality is improving or decreasing in an area. So what is a service evaluation? If we think about the word evaluation, it's about making a judgment and assessing the value of something. So a service evaluation is making a judgment on how well an existing service is working. For example, we evaluate current practices, processes and systems. And service evaluation differs from audit as we do this without reference to a standard. Service evaluation is an essential part of quality improvement and aims to increase our understanding of what and how we need to improve services. So during service evaluations, we collect data from service users or staff to evaluate what needs to improve from a service user perspective. For example, friends and family test, where patients submit anonymous feedback on their experience of a healthcare service. So the underlying principle really of service evaluations is that service users are the best placed people to evaluate services and the delivery and working of that service. So data from local service evaluations can't be generalised. The results inform future planning in a local service, and service evaluations should be repeated to look for changes, so it reflects the cyclical quality improvement approach. So if you're a student looking at quality improvement in modules or your dissertation, or you've got interviews coming up, I've got some very helpful videos. First one, what's the difference between research, quality improvement, service evaluation and audit? The second one, quality improvement and quality assurance in healthcare, has an overview of all the key terms healthcare professionals need to know, and that's especially useful for revising for interviews. And then the video on plan, do, study, act cycle is explained using an example quality improvement project, and I've got some very helpful resources at the end of the slides and references for data collection tools for quality improvement or service evaluation. So I hope you find those helpful. So there are different types of evaluation and ways of describing evaluation, and 2 popular simple ways are as either summative or formative. So a summative evaluation evaluates the overall effect of an intervention when all the data is available at the end. It helps to explore whether improvement has been achieved in a local area, whereas formative helps inform an intervention as it evolves. For example, does it need revising or modifying? And it's used to explore whether improvement has been achieved in a particular environment. And many service evaluations have both summative and formative elements. A useful guide from the Health Foundation 2015 answers some commonly asked questions about how to approach evaluation of quality improvement in healthcare. So do check that out, and have all my references at the end of this talk. Another way of describing the different types of evaluation is formative, process or impact outcome evaluation. So formative appraises how a service can be improved whilst interventions are still being implemented. Process evaluation reviews the implementation of a project, evaluating the accomplishment of achievements and whether they went to plan as intended. Impact and outcome evaluation focuses on the outcomes of a service and whether it's meeting its aims and objectives. Service evaluations also reflect the cyclical quality improvement approach. You don't just go into an area and not revisit. So using the plan, do, study, act cycle of improvement may be helpful if you're doing a service evaluation. You might want to use the National Institute for Health and Care research, resources and framework, which is identify and understand, assess, plan, do, review and act. And there are a lot of service evaluation toolkits out there as well. So do check out what resources there are on your quality improvement hubs and link to your governance leads wherever you work. So I thought it'd be helpful to share two service evaluation examples that I've been involved with, and they're both published so you can download and see more detail on the papers of the process that was involved. They're both linked to staff feedback to develop staff support. And the first one linked to a service evaluation of listening to staff events. We held staff engagement listening events to examine nurses' perceptions of teamwork and support. And this enabled us to identify key areas for development across the service to support staff. The second service evaluation related to developing and evaluating a foundation preceptorship programme for newly registered nurses. We focused on pre and post evaluation. So there was an evaluation to scope preceptorship, what was going on in the areas before we implemented the programme, and that also informed content. And the evaluation consisted of registered nurse and manager views on current preceptorship provision. We collected data, we had focus groups, interviews and questionnaires, and then we implemented a new preceptorship programme as a pilot with 37 nurses, and then we had another service evaluation post-implementation. So I'll link these two examples to the next lot of slides linked to application. A few questions to think about before you go ahead with the service evaluation. The first one is, do you need to do one? Has one already been completed that you can use to save you time? Is it the right time to do a service evaluation? Is staffing too low? Are services being reconfigured? Has there already been a recent staff survey? It's not ethical to take staff out of an area to do a questionnaire or an interview if the staffing is low. Is it financially viable? Who's going to deliver the service evaluation and do they have time? And will I be supported by my manager and employer? Who's going to authorise this service evaluation? And do I have manager buy-in? And reflecting on my service evaluations that I was involved with, neither would have been feasible without senior nurse leadership and support. You can't access staff, send out questionnaires or interview staff without manager authorisation or trust authorisation. I was in a privileged position as an expert nurse who's recruitment and retention lead because I could allocate time to project work, and we set up a steering group to help with the authorisation and collaboratively decided action plans. It's very important to contextualise your service evaluation throughout so that you're using the correct channels, and talking to governance leads, research leads and service improvement leads is really helpful for authorisation. If an evaluation was completed a month before, it's not ethical to take up staff time again. So it's very important to contextualise and find out what's gone on in that area already. So some key areas to think about when you're preparing for a service evaluation. So this is like the plan part of a plan, do, study, act cycle. What are you evaluating and why? Is this the right data to collect? Will it inform improvement? And that should link to your data collection tools. So how are you going to collect your data from staff or service users? So for example, when we evaluated our preceptorship programme, we used a 5-point Likert scale to rate specific elements of the preceptorship programme linked to content and management. It wasn't just about the teaching schedules, it was about what preceptorship was happening in the clinical areas. We also held focus groups at 3 monthly periods over the preceptorship year and evaluated the whether preceptorship reviews, professional development reviews took place, and we gained feedback from managers as well. Whereas the focus of staff feedback in our listening events was to examine nurses' perspectives of teamwork and support in their areas. So we used a semi-structured conversational approach under 4 themes: staff feeling valued, teamwork in the area, staff support, and career plans, intention to leave. So these are big projects, but they give you an idea of the sort of areas you need to think about. What are you actually wanting to focus your evaluation on? So what are your aims and objectives? Who are the key stakeholders, and what are you going to do with the data will help inform your data collection tools. Collaborative working and networking will answer the above as well, so using a group approach. And you also must align with employer values and uphold professional, legal and ethical values and standards. So for example, GDPR, General Data Protection Regulation, needs to be adhered to, the storage of confidential and anonymised data. So if you're asking for staff perspectives, they're not going to be happy if you're going to leave sheets of paper out, or you have an open screen out where their feedback is open so anybody can see it. So you have to have these ethical areas and standards and values professionally that must be upheld. Moving on to authorisation, which is very important for service evaluations or quality improvement projects. Firstly, no new research knowledge is being obtained from a service evaluation. It's not a research project, so they don't usually require full ethical approval. However, this is not always the case. Sometimes ethical approval will be required. So for example, if you needed access to electronic health records to gain access to patients to gain their feedback, you may require full ethical approval. So it's always helpful to check with a local research or governance manager who will lead you through the process. Whether you need ethical approval or not, you must always gain local authorisation from the relevant manager or employer. So in relation to both my projects that I was involved with, they required formal authorisation from trust governance lead and senior nurse. So moving on to the do part of a PDSA improvement cycle, methods and data collection. There are a range of data collection tools that you can use to gain feedback from service users. You could use questionnaires, surveys, focus groups, interviews. You might want qualitative data collection through semi-structured or unstructured interviews or focus groups, and then quantitative data collection through statistics, surveys, questionnaires. And many service evaluations use a mixed method approach. They might involve both qualitative and quantitative, but it's dependent on your project. So the study part of the PDSA cycle and analysing data, the key is being transparent about all findings. So you might have some clearly positive findings and some unexpected and unintended findings. So there should be a process of comparison, for example, pre-post evaluation or evaluation over time, to see if the situation or quality has changed and or comparisons can be made. And you have to acknowledge that sometimes the results might be not what you expected. So I would say with the projects I was involved with, using a team approach is really helpful to how you deal with those findings and that analysis. When we evaluated newly registered nurses' perceptions, for example, and managers' perceptions of preceptorship, there were some key issues came up linked to timetabling. So when we timetabled the preceptorship study days, they didn't meet with service needs, and managers requested blocks of study days, for example. And then when we looked at what was happening in clinical areas, it was evident that we needed more preceptor training days, that some staff didn't understand preceptorship, for example. So dealing with those issues is really important as a team. And also there may be these extraneous variables that will affect your service evaluation. So it's discussing those as well. So if you do your service evaluation, for example, when there's a service reconfiguration, it may affect your results. So the final part of the PDSA cycle, disseminating, learning from findings and acting on those findings. So you need to think about what you're going to do with the data. In the case of the projects I was involved with, we had established steering groups, which is very helpful, and there was collaborative decision making. So who needs to review those findings? Who are the key stakeholders? What do you want to influence? The service evaluations I was involved with influenced future practice and processes going forward linked to preceptorship and retention actions, and disseminate findings locally, and evaluations are ongoing. So there was future evaluations of the preceptorship delivery across the trust. There was future, we continue to do listening events. So it's this cyclical process. And do consider publishing. Obviously, we published our work, and I would love to see more quality improvement and service evaluations shared on publications, using publications as well. So some UK resources and websites: the National Institute for Health and Care Research, NIHR, has some evaluation toolkits. If you network with your quality improvement hubs and your local quality improvement leads, they would have a wealth of experience and knowledge. Clinical governance leads and your senior nurses and networks. The Healthcare Quality Improvement Partnership has some helpful papers, and the NHS website quality improvement resources. So just to help any of the students out there watching this video, I know you need references. There's some really helpful references on guides to quality improvement tools and how to undertake a service evaluation. Nice simple papers and toolkits there. And if you have any questions at all, put them in the YouTube questions. Do give me a thumbs up if you found the video helpful. If you prefer to ask questions, you can DM me on my Twitter account or on my website. And good luck with any service evaluations that you're going to be doing in the future.